relaxed. Okay, the next one, D, is going to be the relaxed position to core neutral to the forward lunge, and you're going to do a contralateral rotation. Okay, so it's starting to build into that story we were just talking about.
Yeah.
So from relaxed to core neutral, go. Quick, so we're looking for the quickness, acceleration into deceleration. When the human body accelerates into ground force reaction, it vibrates the spine. For very briefly, as you can't see it, you probably can't feel it. You might feel it a little bit. That vibration of the spine locks the spine in space. If I push on you slowly, you don't get as much of a locking mechanism as if, unless I go, I'm going to brace myself a little. Here, 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 here. Can you feel it?
Yeah.
Right? That quickness, that suddenness of the force, here, 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 activates the spine to lock in as a unit. Slow motion into the spine, you can feel it. It's not as locked into place, right? Okay, good. Okay, so I want you to go into a forward lunge.
Okay.
Forward lunge, just pick one. Good. And then he's going to do contralateral rotation. So it was right-sided lunge, you're going to go into left-sided rotation. Left-sided rotation, go. Good. Back to neutral. Now I want you to do it as pulses. So go into the range. Good. And then I want you to pulse through this hand to left, left, left. So not so much with your arm, more with the rotation at the TL junction.
Ah, okay.
Okay, now.
Got you.
Okay. Now there's a reason for this. Okay, so starting relaxed, core neutral, right lunge. Good. And then you're going to bring your hand back right, to the right. Now, good. Now I want you to give me a little bit more rotation. Come into more rotation. So just follow me. Yeah, now pulse. And then I want you to push that knee away.
Yep. There we go. Yeah.
So he's at maximum TL junction range of motion. Maximum. Right? But he's also in core neutral. He's working very hard. Right? And then back to neutral. And then relax. So we would do that on the left and the right. We would do that for 2 sets, 10 pulses on each side. Okay? So we had this little conversation before we started, a couple of things I want to make sure that we talked about, and that's to
leading
this
up,
point.
yeah.
Right? So if I come into core or a lunge position here, right, and I rotate, so my hips are here, right, and I rotate to the side, my hips are kind of already open this way. So if I rotate to the side, I have a lot of play, right? I can really I can almost get my shoulders perpendicular, right, straight here, right? Right, without turning my hips. I can almost be in this plane of motion here, like sagittal plane, right? Now, if I switch my feet and I'm in this position and I rotate the same way, I'm stuck.
Got that lock. Yeah.
Right? Yes. TL junction is locked. Okay? So from this position, if I try to rotate, I've hit the wall.
Yep.
And look at this plane of motion that I'm in. I'm nowhere near where I was before, which is like here. Now I can't just put my arms there because my chest is still, right? I need to be able to turn my chest so it's locked. So if you want to teach TL junction stability, you need to go, pelvis is open. There's a reason why we're in the lunge, is to open up the pelvis clearly in this direction. If we want to teach TL junction stability, we go here into the locking mechanism. If we want to teach TL junction mobility, right?
We open up,
Yes, right?
Yeah.
We go into, so all I did was switch my feet. Okay, so yes, a lunge is like some ridiculous thing you can do with kettlebells, and we don't care about that. It's all another show also, right? That's a really short show. It's just like, hey, Dr. Dean.
Vinzel.
Don't do kettlebell lunges. We're done. Have a nice day, Dr. Dean.
Vinzel.
All right, that show's over. Okay, so the beauty of the lunge is that it gives you this opportunity to position the pelvis and have these upper body options, right, to train mobility and stability.
Yeah.
So cool. Okay, so that's drill D, and then we go into drill E.